المرسلين سيدنا محمد وعلى آله وصحبه وتابعين لهم بإحسان إلى يوم الدين أما بعد. Good evening, ladies and gentlemen. On behalf of Kuwait Society for Cultural Dialogue, TIES cordially welcomes you to tonight's Zoom lecture about herbal remedies of the world. Our speaker tonight is Dr. Sharifa Carlo. She's an American College professor of English for scientific purposes. She teaches at the College of Health Sciences. She has formerly studied English, political science, rhetoric, and artificial intelligence. Informally, she's a research freak and has delved into various topics, including natural and herbal medicines. So due to the fact that she has delved into natural and herbal medicines, maybe after the presentation tonight, I will ask her to think of opening a clinic where she will be offering alternative medicine, inshallah, and this will help a lot. Maybe you could start thinking about this, Dr. Sharifa Carlo. So without wasting time, I would like to invite Dr. Sharifa Carlo to begin her presentation. It will take 1 hour. After that, I will introduce some activities of TIES, and then the question and answer session will begin. So you're welcome, Dr. Sharifa.
Assalamu alaikum. Thank you. I am by no means a doctor, so opening a clinic is probably way out of the question. Basically, I got into looking at herbal remedies and so forth when I was having a lot of problems. I had back pains, I had diabetes, and I was starting to take a lot of medicine. I saw myself on painkillers, I was taking nerve blockers, so many different medicines. And some of my friends were getting into the natural medicines and herbal medicines, and I am naturally a skeptic. I see these things and I would listen to them, and then I would tell them, this stuff, it's crazy. We have the modern stuff now. It's, it's safe, it's reliable, they do testing. And I don't know, I decided, let me look into it. When I looked into it, I found that there's a history and a culture of herbal remedies throughout the world. Wait a minute, hold on a second. Okay, I hadn't started the recording, so as I was saying, when I started to look into it, I did so as a skeptic. And as a skeptic, I didn't think any of this really meant anything. I thought a lot of it was, we in the South, we call it hooey, which is something that you don't give a lot of credit to, you don't think it has any value. So again, I started to research because I'm not going to start doing something, or I'm not going to change anything in my life until it logically fits with my, I understand it. I see that it does work. I see that there's science behind it. It's not something that I'm just going to start and that's it. So one of the things that I found is that it is something that it's known all over the world. The origins of medicine, they're deeply rooted in civilization's culture and religious beliefs. And a lot of times it used to be priests that were doing this type of medicine. And most of this medicine was based on experience, observation, reflections, and there was a combination, and there was no separation between mind and body when these civilizations were looking at medicine. And when I thought about that, I said, scientific method involves observation, it involves experience, and of course it involves testing. And the experience is the kind of testing. So I said, okay, well, maybe there's something to this. But still, like I said, when I started this, I was very, very skeptical. And with a lot of it, I'm still very skeptical. I will not accept every single thing that someone brings me. Oh, if you do this and you add this herb to it and you do that. And my grandmother and my my friend told me about it and I saw on the internet and somebody sent me a WhatsApp. I don't accept these things very easily. Again, before I start to use something, before I want to change from something that is known to something that I don't know, I need to investigate it. So again, I continued my research. And I found that in general, what is herbal medicine? It's a kind of medicine that uses roots, stems, leaves, flowers, or seeds of plants to improve health, prevent disease, and treat illness. So if you think about it, where do the vast majority of the new medications coming out come from? They're coming from the Amazon. I've spoken with doctors and they're telling us how they're very worried because the Amazon is being destroyed. And when you destroy the Amazon, all these plants that actually have medicinal purposes are being destroyed. Most of the most of the pharmacy type corporations, they have researchers down there looking at the plants, working with the plants, and trying to find cures through these plants. So herbal medicine is something that actually does go along with science. And when you add to this, I mean, even some of the things that we ourselves have taken for granted, like aspirin. What is aspirin? Aspirin is actually from the white birch tree. It's the bark of the tree that was used to help to relieve pain. So herbal medicine, yes, it's roots and stems and leaves and flowers. And, you know, it's a lot of times people use this in teas, and a lot of time they make like a poultice out of it and they rub it on the body or they put it in a certain area. And again, some of the stuff, it has scientific evidence behind it. Some of the stuff doesn't. So I delved into it more. I looked into the World Health Organization, and they actually have committees and they have researchers that are looking into this, and they've classified it into 3 different types. The first is what they call complementary, and this word, complementary medicine or alternative medicine, it refers to the healthcare practices that are not part of the country or the culture or the conventional medicine, and it's not fully integrated into the dominant healthcare system of an area. Then they have the traditional medicine, and this is the sum total of the knowledge, skill, and practices based on the theories, beliefs, experiences indigenous to different cultures. So whether we can explain it or we can't explain it, whether it's used for prevention or diagnosis or improvement or treatment, whether it's physical or it's or mental illnesses, those treatments that are done by a specific culture are called traditional medicine. So this is a lot of what I'm going to be talking about today. Now, a lot of all this is interrelated, because sometimes something that is traditional makes it into complementary. And sometimes, or most of the time, your traditional medicine also uses herbal remedies. So what is herbal? Herbal is the use of herbs, herbal material, herbal preparations, and finished herbal products as active ingredients, whose active ingredients are plants or plant material or a combination. So WHO itself has looked into all these alternative medicines, all of these cultural medicines. And like I said, they're doing research into them, and they're finding that within them, there are some things that they may work a little bit, some things that they work, but the modern medicine is better for treatment of this. And there's some things that they work actually better than some of the modern medicines, and some things that don't work at all. So still, this was not enough for me. I continued to study. I continued to look at what was going on in the world in terms of herbal medicines, in terms of alternative medicines. And I found that there's many cultural variations. So I decided I'm going to limit it to 6 today, talking about 6 different types of cultural variations. And I'm going to talk about the Native American. These are the ancestral people of the United States in North, South, and North America, Central America, and South America. And the kind of herbal treatments that they used to have, the kind of natural remedies that they used to have. I'm going to look at traditional Chinese, which is very popular all over the world. There's a lot of research that's been done on traditional Chinese. I'm going to look at Islamic prophetic medicine. I'm going to look at Indian Ayurvedic medicine, Bedouin medicine, because, well, we're in Kuwait, and New Zealand Maori. And I'm just going to give you a short, simple breakdown of these different cultures, okay? And again, I'm not a medical doctor, and I don't have a degree in this. Again, what I did was I went and I started to study it and look at it for myself. I was looking for ways to stop my pain. I was looking for ways to lower my blood sugar. I was looking for things that would take me away from all of these medications that I was taking, and something that was safer, something that had fewer side effects. And I came across a few things. I still take medicines, normal Western modern medicine. I do take some of this, but I've been able to incorporate other things as well. So within the cultural variations, we're going to start with the Native American. Now, this tradition pairs with the use of natural herbs and diet with an understanding of spirituality. At the core is the concept of walking in beauty. So what is walking in beauty? This is existing in perfect balance with the natural world. So a lot of the things that most of these medical herbal medicines and alternative medicines have in common is that they all are whole body. It's not just you take the medicine, you take the herb, and you're good to go. With the Native Americans, they believe in intertwining your life with nature, okay? Trying to keep balance between yourself and nature. What you do with nature. Trying your best to keep everything so that you don't destroy the world around you. You utilize what's there, but you don't overutilize it. You don't abuse it. Native American medicine focuses on the patient's physical and spiritual health and their overall well-being. From ceremonies to greet the day or changing seasons to gatherings that bring together people from different age groups to share and delight in each other's energies. So within the Native American culture is this idea of interconnectedness and how the body and the spirit, the body and the mind have to be at one with each other. So this is, again, an important concept that you're going to find throughout. And one of the things that I looked into and realized is that even Western medicine is now trying to take a whole body approach. It's not just come in and get your medicines anymore. It's not just come in and the doctor looks at you and that's it. They are now trying to look at and research the connectedness between the mind and the body. How the mind, stress factors, anything that happens within your life, the things that you are surrounded by, your environment, how it all plays a factor in your overall health. So, like I said, the first one here, this is the Native American medicine. Go on to the next one, traditional Chinese medicine. This is often abbreviated as TCM. It's thousands of years old. It may be one of the oldest versions of natural medicine. that I could find. It looks at the human body as a smaller version of the universe, focusing on balance, specifically the balance between dark and light, yin and yang. So what is this? Within traditional Chinese religions and culture, there is an understanding that everything is in balance and everything has opposites. So you have, if you remember seeing the yin yang symbol where it's half of it is black, half of it is white. It's supposed to symbolize how everything in the world is opposites. You have male, you have female, you have hot, you have cold. So a lot of the medicine is classified into this type of understanding in terms of balance. For instance, you might go to a traditional Chinese doctor, and that doctor will tell you there's too much heat in your body, or there's too much cold in your body. And these things need to be treated with the opposite. So if there's too much heat in the body, which is causing you pain or causing you illness, then you treat it with something that cools the body. So it's an entire religion, culture, philosophy that is throughout Chinese medicine. These herbal medicines, they also include other types of treatment, such as acupuncture, acupressure, which is using needles or pressure to help open the qi channels in the body. And what are the qi channels? They believe that your body, which is actually a reality, we are electrical signals. The nerves in our body move electricity throughout our body. They move signals throughout our body. So they believe that these get somehow cut off, okay? And that cutting off will cause you fever, will cause you pain, will cause you disease, will cause you some sort of a physical and or spiritual or emotional problem or a mental disease. So they use things like the acupuncture, which is, most of you have seen it, if not in TV, maybe you've actually experienced it, needles. And they take these needles and they put them in specific places throughout your body. And the science behind it is that these needles act as conductors, and they help to conduct the impulses that go down your body naturally. Or they use pressure points where you put pressure down on a specific area, and when you put pressure on that area and relieve pressure from that area, what happens is that you are moving the electricity again, or you're taking away the block, or at least lessening the block that's in the body. So another thing that they do is cupping. And cupping for them is the practice. They use small flames and they create suction in the cups on various parts of the body. Different traditions understand cupping and use cupping in a different way. So within the Chinese medicine, the cupping is done with flame and vacuum pressure. So this is your traditional Chinese medicine. The next one we have is Islamic Prophetic Medicine. Now this is the Prophet of Islam, which I believe in, the Prophet, peace be upon him, Muhammad. In the Quran that he brought, and in the statements that he gave us, which is called the Sunnah, he taught certain things about medical treatment. Within these things, there was there's information that it's not just, again, about the physical body. It shows how the body, the soul, the medications that we take, whether they're herbal or whatever, have to be holistic. It has to be body and spirit. It has to be mind and body. It has to be all integrated together. So the prophetic medicine is another type of alternative or modern, and it also includes modern therapies as a supplement to modern medical treatment, and it's based on what's in the Quran and what's in the statements of the Prophet Muhammad, peace be upon him, And again, it includes herbs, it has diets, it has behavior modification. It's a holistic body, spirit, health integration. For example, one of the things is that the Prophet, peace be upon him, he had said that you should not fill, that the worst vessel that you can fill is your stomach, and that the diseases come from the stomach. So even with eating and drinking, he told us to have moderation, that we should eat 1/3, drink 1/3, and the last third, leave it for air. So we need, you know, in this sort of medicine, again, it incorporates everything. And we're also going to show how throughout time and throughout the different cultures, you're going to find that a lot of the information is exactly the same, that they share herbs, they share medicines that they utilize. They share ideas in how to do the medicine, how to incorporate changes into your life, how the body and the spirit all require to be interconnected. Okay, so the next one we have is Indian Ayurvedic medicine. The ancient Indians wrote about medicines in their sacred books, which are the Vedas. The Vedas are believed to be the basis for Ayurvedic medicine, and it's based on the concept of longevity and the nourishment of life. It relies on a combination of herbal treatment, diet, exercise, lifestyle recommendations to ensure health. Again, you're seeing the same pattern. Every single one of these types of medicine are incorporating the body, the spirit, the mind. The basis of this medicine is the universe's interconnectedness. There's a connection between individuals, one to another, and a connection to a person's own health. The world and the universe around them are, again, interconnected. So like the other cultures, much of the medicine is based on what was found in their areas. So when you take a look at the Native American plants that are used, and you take a look at the medicines in India, and you take a look at the medicines in the Arab world, the Bedouin medicine, there are some things that exist everywhere in the world, and they're being utilized by all of them. And some things, they don't exist except in one place. So you'll see that incorporated into the medicine of the people, because of the fact that it's so common and available. And again, all of these types of medicine are based on observation and experience. So throughout time, people are looking at, oh, look, we especially like in the Indian medicine, a lot of herbs and a lot of spices are used. Well, this area is, of course, known for their herbs and their spices. And it's easier for them to have looked at all the different types of herbs and spices because they've been available and they're common, so they can see reactions that people have to them. And they're able to, throughout the centuries, they experimented with them, with combinations, with different utilizations of it. You know, whether it's given as a tea, or it's given as a balm, or it's given as a powder. How is it going to be used? What is the reaction when you use it this way? Now, unlike modern science and modern medicine, you're not going to find the double-blind, you're not going to find that they're doing some kind of research with double-blind studies. What you're going to find is that they did it based on, they tried it on this person, they tried it on that person, and when they tried it on these people, they were able to see that it worked or it didn't work. They were able to see reactions. They were able to see changes, okay? So that would be the Indian Ayurvedic medicine. The next one I want to talk about is Bedouin medicine. Many centuries ago, Wadi Rum nomads discovered the healing powers of a large variety of plants and herbs in the mountainous areas of the Arabian Peninsula. Their knowledge was used and handed down for generations. Their ancient ways of practicing medicine are still commonly used by Bedouin today. In Wadi Rum, they have over 30 plants, herbs, shrubs, and trees that are used specifically for medicinal purposes. So this is, like I said, another group. And when they were looking at the medicines, they're looking at what's available in front of them. They were looking at those things that they could find that would take care of the problems that they had. So again, the same thing. It's a matter of looking at what's available around you, experimenting with it, not in the sense of modern medical experimentation, but in the sense of observation and analysis that was done over the centuries. So the Bedouin medicine is another type that it's very commonly used here. As a matter of fact, anybody who lives here in the Middle East can easily find people that if you have a problem, you can go to them and they know the Bedouin medicine and they will give you the herbs and they will take care of the problem that you have based on their knowledge of the herbs in this area. For some people, herbal medicines may be the only way that they can get treatment because they have too many reactions or too many side effects with the other types of medicines. So again, so we have the Bedouin medicine. The New Zealand Maori, which is called, and I don't know if I'm going to pronounce this right, Rongoa, or traditional Maori medicine, is still practiced today despite having roots that reach back nearly as far as New Zealand's history. It's practiced by Tuhunga, which are your Maori medicine men and women who rely again on herbal remedies, massages, rituals to help their patients manage their physical and spiritual health. And it's been found that many of the herbal remedies that have been prescribed by the Tuhungas actually have antiseptic or antifungal qualities. So this is another interconnectedness that we can see. And I want to talk about all these commonologies. Within every kind of herbal medicine, you are going to find that the whole body is being looked at. It's not just a matter of my foot hurts. They will sit with you, they will talk to you about your life, your environment, your stress levels, your happiness, everything about you. They try to analyze it. Why? Because your body and your mind are interconnected. And again, even modern medicine is starting to understand this and starting to actually deal with it. There's several universities in the United States. When I was doing research, I found that they actually have courses for doctors, medical universities, where doctors are learning to become a doctor, to be able to pass the test and become doctors. They actually have different courses that talk about herbal remedies, that talk about the whole body treatment of the patient. So it's as if the modern world is trying to catch up with and re-understand what was known centuries before, that it's all interconnected. The other commonality is that there's a lot of herbal medicines that are being utilized. A lot of plants, a lot of seeds, a lot of natural growing parts of that which is within the environment of each different culture. On top of this, they all look at diet. Diet is considered important as well when they're looking at to see whether or not there's something wrong with the person. The diet, what they're consuming, is considered extremely important as part of understanding and analyzing and giving the patient medication for whatever it is that they're currently complaining about. Because you could be complaining about your arm, but in reality, the problem isn't your arm. The problem is the stress that has led to the muscles in your arm becoming tight. Oh, and that tightness is not allowing your body to move in the way that it should move. So all of it is interconnected. And again, the last thing is the spiritual. Every single one of these has a spiritual aspect to it. So when you're looking at the medicines, and you're looking at the way that they treat, they want to make sure that the spirit of the person is in some sort of a balance. If you're unhappy, if you're depressed, if you're not in a good way, if you're stressed out, something is going on within your life, your body is going to react to that. So most of these types of cultural herbal remedies, they also talk about things that we as human beings can do to lower the stress in our lives, things that we can do to connect ourselves. A lot of these are religious, and they make a connection between you and God, or if their God is natural or nature, between you and nature, between you and the universe. When in many of the Chinese religions, you'll find that the religion itself is interconnected with the medicine, and they're trying to get you to understand how the interconnectedness between you and the universe. So all of these have the spiritual and religious factor to it. They're looking into diet, they're looking into herbs, they're looking into whole body. It's all of them have these factors. So if you are from a culture or tradition that doesn't allow you to delve into other religions, doesn't allow you to practice things within other religions, then still the medicine that is available, if there is an herb or if there is a seed or there's something that you can utilize that will assist you in healing your body, you choose to take that herbal remedy and put it with your own personal religious belief. Okay, so because if you are intermixing, then your spirit is not going to be relaxed. So look at the commonalities, look at what medicines are available, and go from there. Now, the other thing that I did, because again, big skeptic here, I wanted to see, is there any science that says that this is something reliable, that this is actually showing some sort of benefit for me and when I take these medicines? So what did I do? I started to do science versus herbs. Now the first one, and I'm going to start by looking at the bottom of the slide. You can see we're going to talk about honey first. The honey has been used by Native Americans, traditional Chinese, Islamic prophet, Indian Ayurvedic, Bedouin, and New Zealand Maori. All of them have considered that honey is something that is and has a curative property to it. So what did I do? I went into several databases. I went into the Journal of American Medical Association. I went into the National Institute of Health in the United States. I searched for actual scientific research with double-blind studies where they were replicable. Something that no scientist could go against. And one of the things I found is that honey has natural antimicrobial, immunostimulant, and wound healing properties. What does that mean? That means it kills bacteria. That means it helps in healing. And I was absolutely shocked because one day my father gave me this book, which is called Country Medicine, the Country Doctor Medicine. And in this book, they were talking about how when you have an open wound, put honey on it. So then I was like, wow, honey on an open wound, that sounds wrong. So I went back and I started looking at it, and I have my son is a doctor, a medical doctor. And I called him up and I said, have you ever heard of this? He's like, oh yeah, I've seen it used in surgery. And then I was like, wow, okay, so honey actually does have scientific value to it. So in actuality, the properties of honey, just on a topical basis, just putting it on your skin when you have an actual wound or cut, it actually will help to fight the bacteria. Okay, it's antibacterial. Also, it has MgO present in small quantities, and in highest quantities in what is called Manuka honey. Now, Manuka honey is from the Maori. They are the ones, it's in their area that this plant grew, okay? And the honey, the bees would feed off of this. And it's very, very specific, and you have to be extremely careful when you purchase it, because the Chinese did a study on it, and they found that in China, 90% of the Manuka honey was fake. And you have to know who your suppliers are. You have to make sure that this is actually and truly the real stuff. And that is one of the problems that natural medicine has, because there are no actual regulations that check for your natural medicines the way that you have with the Western medicine or the common medicine in modern medicine. Okay, so in modern surgery, they use honey for enhanced wound healing and prevention and or treatment of the streptococcus bacteria at the surgical site where there is infection. So they actually use it to fight it in surgery. So when I saw these kind of things, I was like, you know, maybe there's more things that actually have some scientific basis behind it. So I looked some more. Now this one, it's used by Native American, traditional Chinese, Islamic prophetic, Indian Ayurvedic, and Bedouin medicine. According to the Journal of American Medical Association review, several mechanisms have been suggested to explain how certain probiotics could exert health benefits, especially with respect to diarrhea. For example, Saccharomyces boulardii. I'm very bad at these scientific terms. A strain of yeast has been demonstrated to stymie the pathogenicity of bacterial toxins. What does that mean? It means that in our bodies, in our stomachs, we have certain bacteria. We have good bacteria and we have bad bacteria. So the probiotics actually help to stop and kill the bad bacteria and increase the good bacteria. So these things can help us to fight intestinal problems, problems in the stomach, problems in digestion, problems in relieving. All of these can be helped by probiotics. Now, we hear a lot about probiotics these days. And even, you know, here in Kuwait, you see people buying all types of things like kombucha and fermented cabbage, you know, sauerkraut and these type of things, fermented vegetables, so that they can help with the probiotic and the what they call gut health. So this actually has scientific basis to it. So again, what you eat, this is food. Most of this is basic food, yogurt, fermented or pickled foods. These help to promote good bacteria in our stomachs. And again, scientific proven, and it was already used centuries ago by all of these different, cultures, as herbal medicines within daily regimens that they had for their people. The next one we have It's found in Islamic Prophetic Medicine, Indian Ayurvedic Medicine, and Bedouin Medicine. Even one of the statements of the Prophet Muhammad, peace be upon him, was that in this seed is the cure for all diseases. So according to research in the U.S. National Library of Medicine, National Institute of Health, black seed has been found to be a proven treatment of ischemia-related disorders in key organs such as brain, liver, digestive system, kidney, and heart. What is ischemia? It is the buildup or the blockage in arteries. So the black seed was studied for this specific condition, which is the buildup of blocks or blockage in the arteries, and it was found to actually work on it. And it was found in another research that it lowers total cholesterol, triglyceride, low density lipoprotein, and body mass index, and increased high density lipoprotein. In other words, it works on cholesterol. It helps to lower the cholesterol. So many of us taking medicine, the older we get, the more you go to the clinic, you go to the doctor, first thing he's like, your cholesterol is high, here's a pill. Well, there are ways that we can fight it. And science has already proven that these ways, which are natural and don't have the side effects. I remember I did, there was a time period it's about 15 years ago, when I had a problem with cholesterol and I took the medicine. When I took the medicine, my eye started to twitch. I'd be standing there and you could see my eye moving up and down, up and down, up and down. Not the eye itself, the skin around the eyes. So when I went to the doctor, it's like, oh yeah, this is just one of the side effects. And when I started to read all the different side effects, I was shocked. And later, I mean, thank God I didn't have to use that medicine for very long. But later, when I started to research and look into these things, I said, oh my God, black seed. That would take care of the problem from the beginning. And it's something that doesn't really have any side effects. It's something that you just, you can put it on the bread, you can put it with some oil and eat it. It's something very simple. So a lot of these types of herbs and so forth, you make them a part of your daily diet. You change your diet, you incorporate them into your diet so that it helps to prevent these problems from occurring in the first place. The next one that I looked at was in a different study in the U.S. National Library of Medicine, same institute. The results suggested that curcum or turmeric, about 1 gram a day, might have similar effects as analgesic medicines. Since the symptoms of osteoarthritis were evaluated mainly by pain, the outcome measures were quantitatively determined by the severity of pain. So when I read through this research, okay, and this is just my short summary of it. When I read through this research, that's when I actually started taking turmeric. I started purchasing turmeric pills, and I started taking it daily because one of the major problems that I had was pain. I had an accident when I was 25 years old, and I had severe pain in my back. And I was, as I said before, I was taking anti-inflammatories. I was taking painkillers. I was taking nerve killers or nerve pain medicine. And all of these had horrible effects. One of which was, of course, that my mind wasn't as sharp as it should be because I'm taking these medicines that mess with my cognitive processes. Also, on top of that, I was tired all the time, and there were all kinds of strange effects. I started to get these weird, like ant feelings in my feet. And when all of this was happening, I said, I have to do something. So I started again. Like I said, I was reading, and now I do use regular medicines. Depends on when the level of pain, what I need, but I daily take turmeric, and I take several other herbal medications that help to keep me going and actually have worked very well in keeping down pain and taking care of other problems that I've had. So the ones that I'm giving to you here are ones that I looked at myself specifically. I did the research so that I could see that, yes, this does work and has a scientific basis behind it. The next one is a study that was conducted on the effects of biological models of hibiscus, okay? And what they found is that it can work on lipid metabolism, anti-hypertensive activity, and the elimination of potentially cancerous and virus-infected cells. And this was observed in the laboratory. So what does this mean? It means that it can help with the cholesterol. It can help with blood pressure. And now I see in certain groups that I talk to people and so forth, they'll say that if you drink it hot or if you drink it cold, it has a different effect. Know that all of these that I'm showing you were not researched as teas. The research that was done was researched on the properties of the substance itself. They took the essence of it. So whether hot or cold makes a difference is not evaluated in these. So I cannot speak to that. And even when you guys do ask me questions, I will only answer based on what I have seen in actual research. If it's something that is a common practice or it's a cultural practice or something that you heard of or you saw on the internet, I will only be able to answer if it's one of these that I've spoken to you about, and again, or something else that I have checked on myself to see that, yes, indeed, it does have a scientific basis. Now, what I can do for anybody is that later, after this is over, you can contact me, and I'm going to give you contacts at the end, and ask me about something specific, and I will go. I will read the medical journals. I will try to find out for you whether or not a specific substance, a specific herb, a specific seed is good for what you've been told to use it for, inshallah. The next one we have is valerian, and this one also, one of the things that I found is that if I sleep well, the pain level is less. So valerian, it's been concluded as a safe sleep and associated disorders treatment. According to the European Medicine Agency, the well-established uses of valerian root include the relief of mild nervous tension as well as sleep disorders. It's important to note that extraction methods could play a crucial role in preserving the therapeutic potency. So that's something that you have to keep in mind. How was the herb extracted? Because the way of extracting it makes a difference as to its effectiveness. So valerian is something that I personally started to use. I take a little bit at night with some melatonin, and I sleep. And the ability to sleep, because if you have pain, it's harder to sleep. But if you have something that relaxes the body, and again, much of pain is from muscle. So if you have something that relaxes the body and lets you sleep, then in the morning, you're well rested, your body is relaxed, and the pain becomes less. However, add to this turnip root, when it was added to valerian for pain, was found to have a significant reduction in acute and chronic phases with simultaneous when we have when you're basically taking turnip root and valerian at the same time, and they have a analgesic effect. And again, who uses this? The turnip root was used by the Native Americans, traditional Chinese, Islamic prophetic, Indian Ayurvedic, Bedouin, and Maori. All of them saw the use of turnip root. And then when they did the scientific research, they added the valerian to it. So you had the relaxing, you had that the valerian gave, and you had the turnip root, which had like an analgesic effect, which is basically a pain-killing effect. So, and you have all of this without being worried about getting addicted to it. without being worried about having some kind of mental problems, thinking problems, basically making you high. Because a lot of the medicines that are used today, they give you a high effect. So this would be an alternative to something like that. The next one is echinacea. It's derived from the roots of coneflowers, and a meta-analysis published in the Advances in Medicine found that the root helps to decrease respiratory infections, especially if you have them recurring, they come and they go, and complications such as pneumonia, ear infections, tonsillitis, and the experts hypothesize that echinacea has immune modulatory, antiviral, and anti-inflammatory effects that appear strongest in susceptible individuals. So when you are having, and it says it's most effective during the illness. So if you're having a cold, it's good to have echinacea, and usually it's taken as a tea. If you have, if you are the kind of person that, you know, I have a friend that every single time she gets sick, she ends up with pneumonia. Taking something like this will help to lessen the effects of this, okay? Now, let me talk about the cautions. Number one, not all natural and herbal remedies are the same. When you buy a natural medicine or an herbal medicine, you need to make sure that it's, number one, authentic. Number two, that it is the real deal, that it is, like if you're buying the Manuka honey, that you're actually getting the honey that the bees fed off of this plant. Because if not, you're not getting the high value that you would get out of it. I don't suggest that anybody just start because they heard or they saw or a friend told them or they saw it on the internet, or for whatever reason you just start taking something. Again, I'm a high skeptic. Look for scientific evidences. If you don't have the ability to go online and check it out for yourself, to read the medical journals, again, you can send me a message and I'll do my best to help you. There's no quality control, okay? So there are some associations around the world that do work on quality control. So make sure that when you buy a medicine, that you try to get one that has high quality control. You need to know that herbs, like medicines, can react negatively with each other. Sometimes they can cancel each other out. So again, you need to have the information before you just start taking something. And there are herbs that are given within certain cultures. There's no scientific basis to them, and they've actually been found to harm internal organs. So be very, very careful. So here in the end, these are, I have Instagram, I have Twitter, and I have, what do you call it, a YouTube channel. So feel free to contact me, send me a message, and I will do my best to get back to you if I have an answer, to the best of my ability. Thank you.
Thank you very much, Dr. Sharifa, for this important and informative lecture. Yeah, inshallah, we'll try to implement your suggestions, and we will try to find those herbs and make sure that we benefit from them, and may Allah subhanahu wa ta'ala reward you abundantly. So allow me, Sister Sharifa, before we go into the question and answer session, to introduce TIES Center. TIES is among the projects of Kuwait Society for Cultural Dialogue. TIES is an acronym for Tolerance, Information, Empowerment, and Solidarity. At TIES, we offer a variety of services to English-speaking people, especially expats, and especially those who are not represented elsewhere in Kuwait. We offer the following services, among others: information about the local culture and Islam to interested people, Arabic language courses, and we will soon start English language courses. We also offer marriage courses and counseling. We also offer specialized and customized courses such as effective communication, applied behavior analysis, teamwork, among others. And before the coronavirus pandemic, we used to conduct visits to places of interest in Kuwait, but because of the coronavirus pandemic, we no longer have do that. And we hope that inshallah, very soon, we will start conducting such visits. So lectures like tonight's lecture are very important for our mission to share information with regard to different aspects of life so that people benefit in different ways. I personally have benefited from the lecture tonight, and I have written down some notes that I will share with my friends who are suffering from different diseases. And this, I hope, will help very much. So if anyone has any questions, any comments, please feel free to do that. Dr. Sharifa is more than ready to answer the questions and give comments. And inshallah, we hope everything will be we hope everyone will benefit from tonight's lecture. Jazakumullah khair. So any questions?